So, I'm a primary care doctor and I wanted to make a video to explain the notion of the body mass index, which comes up frequently because you come into your doctor's office and we get all these vital signs on you and we calculate your height and your weight, and then we start talking about your BMI, and I think it can be kind of confusing sometimes what it is. So I wanted to make a video about that. So your body mass index, or your BMI as it's abbreviated, sorry if my handwriting is a little messy here, can be calculated by a formula. So we can say that BMI is equal to your weight, and it makes sense that weight is at the top of the equation because the heavier you are, the higher your BMI is going to be. And this is in kilograms because we're doing things in metric units. So you can take your weight in pounds and divide by 2.2, you get kilograms. You want to divide this by your height, and we're going to be doing this in meters. So you have to convert your inches to centimeters and convert to meters, and then this whole denominator is squared. So once we plug our numbers into that equation, we get a number. And what does that number mean? Well, let's start off with what's considered normal. And I say what's considered normal because the BMI is not a perfect equation. We'll talk about that a little more in a minute. So normal is anywhere from 18.5 to about 25. Okay. And then if you're less than that, if you're underweight, then you have a BMI less than 18.5. And we use this, to clinically diagnose patients who are, malnourished, anorexic, things like that. Then if your BMI is higher than normal, then you could fall into the overweight category. And this includes people who have a BMI that's anywhere from about 25 to 30. There we go. And once we get above 30, we're in the category of obesity. And different places will even have different classifications of obesity, depending on how far above 30 you are. But we'll just keep it simple and say obese is anywhere greater than 30 for now. Okay, so you can do that and calculate a number out on your own, or if you wanted to plug your numbers into a website, then that's fine too. I'm actually going to bring up Google, and I can show you a website that I like to use. So if you just type in like BMI calculator, then I think if the first one that comes up after you ignore the advertisement is this one right here. It's actually from the NIH, and in particular a branch of the NIH called the National Heart, Lung, and Blood Institute. And this is a very nice resource because you can click on here, put in a height and a weight. Let's suppose you're someone who's 5'8" and 150 pounds. Compute your BMI, and it'll give you something that here is 22.8, falls within the range of what's considered normal. So here again is that classification system that we talked about. And what's nice is that they also have some other information here, because there's some people who fall in these other categories, overweight and obese, that want to kind of get a little bit more information about diet and exercise, and there's some good resources here. They also list here the limitations of the BMI, which we kind of alluded to earlier when we were talking. So one thing is that, just looking at your height and your weight isn't perfect. And they list a good example here, especially in athletes. If you've got a lot of muscle on you and you're heavier weight, you're not necessarily unhealthy or at higher risk for, heart disease, stroke, diabetes, or things like that, because it's not really taking into account your muscle mass. Also, they make a good point in saying that, in some of our older patients, they have less muscle mass, so there's actually more fat than you might expect for someone else who has the same BMI and height and weight. But if you really wanted to figure out what percentage body fat you had, you could probably get a body composition done. Unfortunately, this isn't something that's covered by insurances, but involves going into the machine that does DEXA scans, and it can tell you like how much body fat you have and where in your body it is. This site also goes on to kind of list waist circumference and that being a risk factor. So for women who have a waist size greater than 35 inches or men with a waist greater than 40 inches, that's a little bit concerning because we know that if you have more weight, around your abdomen as opposed to like maybe on your hips or your bottom, that fat is actually sitting on some of your vital organs and could be a little bit more dangerous. They list some risk factors here, and then when you come back up to this menu that they have, there's some links on how to control your weight, eating right, and I think they also list some recipes and some of these resources here. So it's a pretty good resource, and I think that was all I wanted to say about our introduction to BMI. Hopefully this will be an ongoing series that we can do about kind of healthy living and just more information that we can put out there. All right. Thanks.